Hi, guys! Welcome to another podcast, Life Unfiltered. Joining us today is Heling, also known on her TikTok, Life Beyond the Bedside, as a continuing healthcare nurse in London, bringing insight and clarity into NHS continuing healthcare assessments.
Hi, Ash.
Hi, Heling. Finally, we met.
Yeah.
I think it's been months since we've been talking in TikTok.
Yes, yes. And thank you for inviting me.
Yeah, thank
I
you as
hope
well.
this podcast will help some of our fellow
Yes,
nurses as
will
well. Yeah.
definitely help. So, as all of you don't know, we've been talking like for a few months already. I stumbled upon her TikTok account. Actually, I don't know, but it suddenly appeared in my FYP page. And I thought, oh, this one is very interesting and it will help a lot of people. Actually, not only nurses, but also other people like inside what continuing healthcare nurse is. Yeah. So, can you tell us about your nursing journey and how you became a continuing healthcare nurse?
So I was hired from the Philippines as a community nurse. And I came here in the UK in 2018. So after I passed my OSCEs, I moved to palliative nursing, where I worked bedside and then the day hospice, and then moved to the advice line. So it's not my first time to have a hybrid setup. So during that time, because of the advice line, I was able to have a hybrid setup because we were just on the phone giving advice. And then after that, I moved to bedside nursing. That's an oncology ward
Okay.
in a
What
private.
year was that? Sorry.
So I moved. Was it
To
20?
oncology.
I think 2020, the start of the pandemic. But there wasn't a lockdown yet.
Okay.
So yeah, there was some regrets doing bedside. It was oncology nursing, as I've said, but it's another story. And then when I got my settled status, I resigned.
Okay.
I became an agency nurse for about a month. And then I saw the vacancy for a continuing healthcare nurse assessor. So I applied and luckily I got the job, and now I'm very happy to be a nurse assessor. And yeah, I want to share my journey because it was a long journey for me to be
Yeah,
where I
that's
want to
true.
be.
Yeah.
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 Yes.
And what made you decide to, or what made you choose this over bedside nursing? What changed your mind? Or was there an incident that you suddenly, or were you burned out because of the COVID? Or what made you decide that, okay, I want to stop bedside nursing, I want to change to a
So
different?
it was a combination of, being physically burnt out, emotionally burnt out as well, and I was postpartum
Ah,
as well.
yes,
So I
yes.
had a baby in 2021.
Ah, that was the pandemic time.
She's a
Oh
pandemic
my
baby.
gosh.
Yes,
So
yes.
it's a pandemic baby. COVID
Yes,
baby.
yes, yes. So it was really a combination. There was some management issues as well. So I developed a lot of anxieties working bedside. And I worked bedside before in palliative nursing, but it wasn't the same. And then so I developed a lot of anxieties. I was diagnosed with high functioning anxiety. I had therapy for a bit, and then my therapist told me that the job was my trigger.
Okay.
So
Oh
I had
my
to leave the
god.
job.
Yeah,
That was
stressful
my
job.
goal. Yes, yes. I
Yeah,
mean, not everyone is burnt out in working bedside,
that's true.
but it's not for everyone. Yeah,
Yeah.
definitely not for me.
Yeah. So that changed your mind like, okay, I want to move to a different environment.
Yes, so I had a goal. So that's why I resigned when I had my settled status.
And was your husband here as well with you? Did you came together or no?
So I came here first. I was still single. We weren't married. And then after a year, we got married. And
And
then,
here in UK.
no, no, no. I went home to the
Ah,
Philippines. We got
okay. You got
married. And
married
then
there.
I brought him after a few months. So 2019, he was already here before the pandemic. So,
Ah, before the
yeah.
pandemic. Oh, that's good. So before the lockdown. Yeah.
Yes.
And how long have you been an NHS nurse assessor or continuing healthcare assessor? And have you seen any changes so far in the NHS?
So yeah, I started in the NHS in 2018 and then left in around 2020, and then so continuing healthcare is part of the NHS. So I'm part of the NHS now since 2022. So yeah, there are a lot of changes. So the biggest change that I see is the demand on the services and the
Ah,
staff.
yes, yeah.
So there are a lot of budget cuts. I mean, it's in the news. Everyone is affected.
And they stop hiring as well from like overseas workers.
Yes,
Yeah.
yes.
So
So
there's a lot of changes now because of the budget.
yes, but on the positive note, there was a shift in digital working.
Ah, yes, yeah.
Yes, so now there are digital nurses. Continue, before it was all face to face, but now you can work remotely or have a hybrid setup. Being a continuing healthcare nurse assessor, disability or functional assessors. So this gives us the flexibility,
Yes.
which is very helpful, especially when you have kids.
Yeah.
So
Because you can stay at home and also go to the office or go to the patient as well.
yeah,
So
so
you have time for your kids.
even with community nursing, so there are a lot of roles in the community. Some of them before they were office based, but now they're allowed to just finish their task for the day and then continue doing the notes at home, or even have one day to work at home. It's really helpful, and I think now the NHS is focusing or paying more attention with the staff well-being,
Ah, yes.
which
Yeah,
is
of
which
course.
is really good.
They have to.
Yes.
Yeah, and now I saw there's a virtual ward nursing as well.
That's digital nursing.
There's
Yes, yes,
digital
yes.
nursing as well.
Yes.
So there's a lot of things now that you can branch on nursing or change from bedside. There's a lot of choices now.
Yes, that's why I share it online. That's why my page is called Life Beyond the
The
Bedside.
bedside, yeah.
So
That's very witty actually. That her name's Live Beyond the Bedside.
yeah, yeah,
Yeah.
because sometimes we're stuck working inside the hospital, and we're not aware that nursing doesn't have to be in the ward or doesn't have to be bedside. There are a lot of role that we can explore.
But actually, some people as well enjoy the busy, the toxic environment as well, like A&E or the ward.
Yes,
Yeah,
yes,
they like
yeah.
the action or maybe, and as well because they have a lot of extra shifts as well.
Yes,
Yeah,
there's
they
there's
have like the bank
definitely
shifts.
more pay when you work in shifts. But now, because we want to take care of our
Well-being,
well-being,
yeah,
yeah,
mental health,
yeah.
yeah,
So
yeah,
I,
peace of mind.
it's called soft nursing.
Ah,
Yes,
yes,
yeah.
yeah, soft nursing. So, can you tell us your typical day as a CHCC assessor or nurse assessor?
So first of all, I just want to tell you what continuing healthcare is, so that we
Yes.
have,
Yeah.
because a lot of people are actually messaging me. Some are Filipino, some are,
Yeah. Yeah, I saw a lot of comments like, what does it mean, like CHCC?
yes.
What do you do, or
Yeah,
Yeah.
there's a lot of people asking me, messaging me on TikTok about what I do, what the role is. So, continuing healthcare is a funding that is granted to patients who has a primary health need. It's not means tested. So, this is
Sorry,
also
what's that? That
it's
mean?
not means tested. So, for example,
Okay.
so social services gives out packages of care, and but they check if you have money, if you can pay for it on your
Ah,
own.
okay, okay.
But they provide this packages if your needs are more social rather than health. But if it doesn't mean that you have health needs, that you'll be eligible for continuing health care.
Oh, so not everyone is eligible then.
It's
Yeah.
yeah, we need to check that, we need to assess. That's my job. We assess if a patient has a primary health need, but primary health need is not straightforward as well. This is something that we learn as a nurse assessor, through our experience and the guidance of senior nurse assessors as well. It's not like you'll have training before you start the role that you'll be able to know if it's a primary health need or not.
So you have a mentor to guide you during.
Not really a mentor. Yeah, yeah. We have a buddy system when we first started. We have trainings conducted by the NHS England. So yeah, we have this regular trainings, and then it's really through experience because most of my colleagues are with continuing healthcare for more than 10 years, and 50 years old, 60 years old. It's a mix of ages. We are the newbies of
Yeah.
continuing healthcare.
So how long is the training for to be a CHCC nurse assessor?
So the training is we have an online training that we have like every year. So there are different kinds of training like because we have two forms. It's called a checklist and a DST. So we have this it's not like you have a 1 week training and then you'll be the best.
You'll be on your own. And like,
Yes, yes. So
bye bye.
we constantly communicate with my colleagues, the senior nurse assessors, and then through their experience, they are able to advise us on our recommendation because we don't make the decisions. It's still the panel. So panel is composed of we work closely with social services.
With social services. And
Yeah,
do you
and
work as well
continuing
with the
health.
doctors?
Yeah, so my typical day is I work from 9 to 5, Monday to Friday. I don't work weekends and bank holidays. And some days I'm at home typing my reports, booking assessments, answering emails, meetings with colleagues or our leads. And then other days I'm out going to patients' homes and nursing homes. So we have meetings to my to carry out my assessments. So this is with social workers, nurses, rarely the GPs or
Rarely,
doctors,
okay.
rarely, but we make contact with them if we need information. So
So what are the challenges? Because you said that you're going to patients' home, to communities, and you're also working closely with social services. So what do you think, or what are the challenges that you encountered?
the biggest challenge is not the reports, the deadlines, or the travel. It's handling difficult conversations with the family or the patients, because at the end of the day, it's money, it's funding. Some people are not very accepting of our recommendation, so there are complaints, appeals. No matter how you please them, sometimes you just can't because it's money, and you understand because they're overwhelmed, they need support, but the question is who will support them. Will it be the NHS? Will it be on their own, or will it be social services? So they're just overwhelmed. So what I learned about that is you just need to practice active listening.
That's true.
Yeah, because sometimes they just need someone to listen to them, explain to them in terms that they would understand.
So good communication is the key.
Yes,
Yeah.
and aside from that, empathy. Empathy is really important because they can tell with our body language if you really cared for them. So yeah, that's the
And did
biggest
you
challenge that I
encounter
have.
difficult, for example, can you give like a scenario that you encountered difficult, either relative or a patient?
A lot of times because we deal with complex situations. But for example, I don't
Yeah.
know if you know, you worked in the ward before.
Yes, I
But
work in
there
the
are families who are just different from, they're not straightforward. Like they have lots of requests or they're very anxious. So if I know beforehand, before my assessment, that this family could be difficult, I would always ask for support
Oh, okay.
from my colleagues. So we're not always alone doing the assessments.
Ah, okay. I thought it's only you there.
Sometimes if
Yeah.
the case is very complex, we go in pairs so that there's maybe a witness or we can help out each other so that it's not also overwhelming for us.
Yes, that's true.
Yeah, so yeah, it's a daily occurrence for me. Complex.
Yeah.
There are straightforward cases. I'm happy with that, but yeah, my job is not boring at all because
Yeah, because it's a mix. It's a good mix of like home, and then you have your time for yourself, for your kids, and also a
yes,
mix of interacting with other people as well,
yes,
and then speaking with the patients and relative. So you have actually best best of both
combination.
worlds. Yeah,
Yes, yes, yeah.
combination. Yeah. So what can you say to the viewers, or what can you advise, or how do you become continuing healthcare nurse? Because there's a lot of questions I see in your TikTok. They're always asking like how to become one. I think I asked as well.
Yes.
I think one time I asked as well how I want that, like how to become a nurse assessor as well, because there's like it's like virtual nurse, digital nurse, and this is nurse assessor, because both are
Yes,
different.
and people confuse my role with disability nurse
Ah,
assessors.
yes, yeah.
So if you're a disability nurse assessors, they assess the eligibility of patients with disabilities, mental or physical disabilities, if they're eligible for the PIP allowance, personal independence. I forgot,
It's okay.
but it's a PIP
PIP,
allowance.
yeah.
So yeah, so it's different. Ours is we provide funding for packages of care or nursing home placements.
So like nursing home placement and package of care. So that's
Yes.
more nurse assessor. And disability is like, are they able to work like that,
Yeah, yes. It's just
or
an
fit to work?
allowance.
Ah, okay,
Allowance,
allowance. Yeah.
yes, yeah.
So how can they become, or for example, like, can you give like sample interview questions, or
A lot of
yeah,
people are asking me that, and I give
people want to know
advices. I
that.
get
Yeah.
advices. So I was thinking, should I make a living out of this? Like,
Yeah.
make their CV.
Yeah.
So, yeah, but yeah, first of all, explore what a nurse assessor is, a continuing healthcare nurse assessor specifically. So go to NHS jobs and then look for CHC nurse assessor. Read there's vacancies everywhere. Read the job description. So you will know if this is the right fit for you. And then you have to, because we write a lot of reports, so you have to
Do you need to
know.
be like quick in typing? Like, is
It will be an
there?
advantage for
Yes,
you
yeah.
because we have deadlines, we have targets, but not necessarily. But you need to be organized, and you know how to
To manage your
use
time as well.
time
Yeah,
management is
time
really
management is the
important.
key.
Communication skills, community experience is important as well. You have to check the requirements on the job post because sometimes they require community experience as well.
Do they require, sorry, do they require driving license as well? Because I read some like you need to have a driving license.
In London, no.
Ah, okay.
But of course, countryside, you need to have a driver's license because the homes and the nursing homes are far from each other. So that's why some require driving
Driving
license. But
license.
for
Okay.
us, London is very accessible.
So what are the sample interview questions that you encountered? Like, at least give like maybe
Yes, yes,
three.
yes. First, it's safeguarding. Safeguarding. You need
Okay.
to learn about safeguarding, and then actually, because it will be different questions for different trusts. So, but I would suggest they read the continuing healthcare framework. You can find it in gov.uk and read about it.
Okay.
You can't just look at my videos and say, oh, her job is easy, or it's soft nursing. I like to do what she does. You have to be knowledgeable.
You have to be equipped for the job. Yeah.
Yes, yes. So just an overview of what continuing healthcare is, because that will help you to be shortlisted.
Shortlisted.
Yes,
Yes.
and then if you're working bedside, you have a lot of transferable skills, communication skills. Every day you're talking to patients, families, you're assuring them.
Yeah.
What
You know
else?
how to build a rapport with the patient and relative.
Yes,
Yeah.
making care plans. So because I read care plans as supporting evidences, so that you already know how to make care plans, and you make notes. You look at evidences. So that those are some of the transferable skills that you can highlight. Because when we write our CV or our application, we have to sell ourselves.
Yeah,
Because
that's true. Because a
yeah.
lot of people I see they read in like, I didn't get shortlisted, or I'm thinking that maybe in the CV or in the essay that you need to pass, that you really need to sell yourself. Yeah.
Yes, yes. So it starts with that. And if you don't get shortlisted, then don't lose hope. Try again.
Try and
Learn
try,
from it.
yeah.
Learn from it. Improve your CV because they don't know you personally.
Yeah, that's true. So they need to know about you already in the CV before meeting you. So you need to sell yourself. Yeah. So just to recap, so what you said is research, and then read the post about the post,
The
because
job
yeah, the
description.
job description usually it's in the when you apply, they also already put there the job
Yeah,
description.
it gives you a lot of information already. Yeah.
So read the job description, research, and you can actually watch as well, like your
Yes, I
TikTok.
forgot to mention that.
Watch
Follow
it.
me on TikTok. I have a Facebook as well, Helating, or Instagram, because not everyone has a TikTok account. There was one nurse who messaged me, and she said she found me on Facebook, and she forgot my name.
Okay.
So she really had to find me because she doesn't have a TikTok. She went on Google to
Ah, okay.
search for
What
me.
did she find you in
She
Google?
found me. She
Oh
found me.
wow. Sikat.
But she found my account in Google.
Okay.
So yeah, so I have an Instagram, Life Beyond the Bedside, but on Facebook I'm just Helating.
Okay. So Facebook, Helating, and TikTok is Life Beyond the Bedside.
Yeah, and Instagram as well, Life Beyond the
Or do you want to
Bedside.
say anything to the people, or you want to give shout out?
Shout out to my colleagues if they
Ah.
see this, because yes, I think
And do they
last
know that you're gonna be in a podcast?
no, but
You want to surprise them?
last Friday or was it Thursday, my manager, she finally found me on TikTok.
Oh my gosh. Were you okay with that? That she found
she,
you?
she 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 loves my content.
That's good.
Yeah,
That's
she's very
good.
supportive, and my colleagues as well. They're supportive. We make videos. I make videos for my team as well. Just doing things for fun,
Yeah,
and
yeah.
we look after our well-being, which is really important. We're getting old, and there's a lot
You
of
need like
pressure.
work life
Work life. That's
balance.
one of
Yeah.
my content as well. Work life balance. I just want to motivate other people that we need to have work life balance, take care of our mental health, because I came from a situation where I it was so bad for me. Like I was crying on the way to work, on the way back home.
And it's hard for you to sleep because you're anxious already about your job.
Yes, forgetting to give a patient ice.
Oh my
And then
god.
in the middle of the night, I'm like, oh, I forgot to
God, you remembered.
yeah, yeah. So I came from that situation and then transition into a role where I'm very happy with what I do.
Yeah, that's the thing, that you need to be happy with your job, with what you do.
Yes,
Yeah.
and one thing I want to say is that we need to advocate for ourselves. No one will look after us. Everyone is busy with their
Lives,
own
yeah.
lives. So, yeah, we need to take care of ourselves because at the end of the day, we're human beings. We're not superheroes.
That's true. Yeah.
We need to, if needed, we need to ask for support and not do all the things on our own.
Yeah. And then you can also ask for help if you need to. But some people are
Yes.
like, no, I can do this on my own. Yeah,
We
I
need to
can manage
try.
this on my own.
Yeah.
Yeah. And don't be shy to ask for help, because here the GPs or your hospital is very supportive about your well-being and mental health. Yeah,
Yes.
there are a lot of help because well-being center, they have a lot of well-being center when you can ask for help. Yeah, so don't be shy, especially now that it's winter. So there's like a winter depression. Yeah.
Yes, yes, yes.
So don't be afraid to ask for help. And I hope from this podcast that you learn a lot of things and the stigma of the nurse assessor. So you actually know what a nurse assessor really does. Okay. And thank you for watching, and thank you,
Thank you
Helen.
for
Thanks so
inviting
much.
me.
Yes, thank you as well. And hopefully we'll have another podcast in the future.
Yes,
Maybe another topic.
another topic.
Yes.
Yes, yes.
Yes. And thank you guys for watching, and hopefully you're like this video and subscribe on our channel, and we'll be having more podcasts in the future and travels, food, tutorials as well. And thank you. Thank you so much, and happy new year guys. Thank you. Bye.
Bye.
Nice.
Thank you.
Okay naman.
Okay naman. Sa vlog.
Bringing insight and clarity into NHS continuing healthcare assessments. Ano ba? Assessments. Sorry na. Ulit, last na.
Okay, sige, go, go, go.